Good morning and good afternoon to all of our attendees. Thank you for joining today's Family Office Network's webinar series featuring COVID response partners. I would like to take a minute to introduce our speaker, Dr. David Olson. Dr. Olson is a physician specializing in internal medicine, but he is also a documentary filmmaker, mountain climber, and entrepreneur. His film K2, Serene of the Himalayas, won awards at film festivals around the world. He has documented a veteran's amputee climb to summit of Everest and even filmed a commercial at the South Pole after skiing for 8 days to reach it. Dr. Olson's electric background has made him skilled at responding to challenges with creative solutions. When the COVID-19 pandemic broke out, he was working at the epicenter in Seattle when he created his consulting firm, COVID Response Partners. At the end of today's presentation, we will have plenty of time for Q&A, and we always encourage your questions. To submit your questions, please use your questions chat option on the right side of your screen to send over all questions. And Dr. Olson, I will let you get started.
All right, thanks so much, Lindsay. Hello, everybody. My name's Dr. David Olson. Thanks for the intro, Lindsay. Apologies in advance if you can hear other people talking in the background. It's because in typical COVID fashion, my wife and I are having simultaneous meetings in adjacent rooms. So you might hear her speaking to her audience. A little bit about me. As Lindsay mentioned, I kind of started out my career as a photographer and a filmmaker, climbing mountains, going on expeditions around the world, and this really gave me a lot of perspective on people, on how to deal with crises and emergencies, how to respond to challenging circumstances. Something I still enjoy, creative pursuits, but I've also always had a very strong interest in the sciences. I originally got a degree in biology, specializing in ecology. So I'm always very interested in the way that systems work and how processes interact with these systems. My life trajectory, started to kind of take a change. As I got a little bit more serious about climbing, going on bigger trips, I started seeing more accidents, broken legs, high altitude pulmonary edema, and getting involved in, rescues and things like that. And started making me think, oh, maybe I should do something different. I've been an emergency medical technician, worked in a ER for a while, but I thought about maybe taking it to the next level. Finally in 2009, I went to Pakistan and made a documentary about the mountain K2, which is the world's second highest peak. I was there on the 100th anniversary of this gentleman's expedition. This is the Italian Duke of Abruzzi. So I made a historical film that highlighted his 1909 expedition and showcased some of the amazing photographs taken by this gentleman whose name was Vittorio Sella. He shot these incredible photographs on 30 by 40 centimeter glass plates with a camera that you can see there, and was somebody that Ansel Adams actually cited as one of his influences. When I came back from that trip, I decided, okay, I'm going to go to medical school. And right as I was in the middle of my first year of medical school, I managed to finish this film, K2 Siren of the Himalayas, and took that on the festival circuit, and did a whole bunch of other things that I would love to tell you about. I've scattered some other pictures throughout this. But needless to say, my education and my years in residency basically brought us right up to 2019 and into 2020, which, as everybody knows, has been sort of an apocalyptic year, I guess would be the way to put it. I was working in Seattle at the epicenter of this crisis, and I was really struck by a couple things. I mean, for one, the economy was completely shut down. There really was a lack of information, and there was a really inept government response. And looking around, surveying the landscape, I realized that it was going to take a lot more than government intervention to get industry back on its feet and to help people navigate this crisis. So I decided to start a consulting firm. We started talking to enterprise clients and a lot of private families. We developed screening and testing programs with a custom interface. This was, one of the first things I did was sit down and design the underlying logic of what I thought would be the optimal screening and testing program, and even incorporating telehealth for taking care of people who are symptomatic. Launched a website, started looking for customers, and over the last year, COVID Response Partners has really focused on three things. That's medical direction and consultation, testing logistics. We have gotten really good at putting people anywhere in the country very quickly to conduct tests or to mitigate outbreaks. And the third is our program management dashboard. We developed a text-based screening system for employees and a dashboard that brings all this information into one place, both for our management of the data and the information, but also for our clients who take a more active role in managing their own programs. They're able to use this to enroll people, to check on results, to follow trends in the data. This is the north side of Everest, just for fun. Over the last year, we have been doing weekly testing programs since April of 2020. About 10,000 individuals have been tested with us, about 15,000 tests administered. We now have weekly operations in 5 states, but we do have infrastructure that reaches nationally. We've had continuous month-over-month growth, and we achieved profitability in about 7 months. Here's a chart of our gross revenues over the last year, just kind of steadily going up. And it's been an interesting ride. Last year, we had a net profit of $173,000 on $675 of income, and we're closing in now about $1.2 million in gross receipts over the last year. So where does the pandemic stand right now? Well, unfortunately, there are a number of states that are seeing upticks in cases, and this is reflected in the national data. It's not as bad as it was, but anything that's not falling, makes us a little bit unhappy as physicians. Throughout the pandemic, the thing that I have looked at most frequently is hospitalizations, because hospitalization rates don't change based on how many people you test. So it really is, I think, one of the purest metrics of what is going on and what the stresses on the healthcare system are. Currently, hospitalizations don't appear to be increasing, but it does look like we're starting to have a minor uptick in deaths. So something that we'll be paying close attention to over the next few weeks. I think, one of the things that has been a major concern for a lot of people lately is these so-called variants. Now, there are 4 or 5 common ones that people talk about and are aware of, but in reality, a virus like COVID is almost infinitely variable. And, there are perhaps hundreds of so-called variants out there. It's just that most of them differ from one another in ways that are insignificant. These 4 are of more concern because they actually have functional differences. They are more transmissible, or they potentially cause more severe disease. Or in the case of the South African variant, there is very good data that appears to show that vaccines are much less effective when you're dealing with that one. So the bottom line message here is that what is most important right now is to get as many people vaccinated as quickly as possible in order to basically decrease the size of the population that this virus can be circulating in, because every time this virus is in somebody and replicating, this is where the mutations crop up. This is where the variation between these variants comes from. And so breaking the chain of transmission is really important for limiting its ability to evolve. This is a graphic that was shared with me really close to the beginning of the pandemic. And it talks about the 4 waves of impacts of this pandemic. The first wave, of course, is this immediate mortality and morbidity of COVID-19. And I think a lot of us thought that it would be just one spike and then it would kind of trail off. And unfortunately, as everyone knows, we've had two major spikes in mortality, the second one being worse than the last. And we really are still coming off of the tail end of that curve and hoping that there will not be a third spike here as we get closer to the summer. But regardless of how well the vaccine rollout goes, there are these other impacts. The second wave is the impact of resource restriction on urgent non-COVID conditions. When I was working in Seattle, one of the kind of bizarre effects of the pandemic was that non-COVID related hospital admissions went way down. People were afraid to go to the emergency department. And we know that this was having a very negative effect because you look at places like New York City, where this is kind of morbid, but the number of people found dead at home last year was far higher than normal. And what that indicates is that, people who are having chest pain, for instance, having a heart attack, maybe they decide, no, I don't want to go to the ER because I am scared. And so there's been a lot of excess mortality just because of the fear of engaging with medical services. And then, of course, the third wave is this impact on chronic conditions. So, this is people not going to their yearly checkup or not getting their medications refilled, or not interacting and engaging with the healthcare system in a way that picks up on worsening of chronic conditions and getting people the care that they need. And then lastly, there's this fourth wave. And this is one that my colleagues and I talk about a lot as something that we're probably going to be seeing ripple effects for years, if not decades, ahead of us. There is already right now a very serious mental health crisis in this country. I mean, rates of suicide are up, depression, anxiety. This is a major problem for a lot of people, and the lockdown, the pandemic, everything that's gone on over the last year has been pretty difficult for people. So what's next? This is a mountain called Artesanarahu down in the Cordillera Blanca of Peru. Well, so COVID certainly has disrupted the healthcare system. And the pandemic is diminishing. Unfortunately, I think it is likely that this coronavirus is one that is going to end up sticking around. There are several other coronaviruses that I test for on a regular basis that are part of the ecosystem of viruses that infect people, and this may become one that that continues to circulate among people. Luckily, evolution tends to favor versions of viruses that are more transmissible but less deadly. So, we hope that in the future, infection with this particular strain of COVID will be, something more akin to a cold and not cause the sort of excess mortality that it has been. The biggest disruption to the healthcare system, I think, has really been in telehealth. I mean, telehealth has taken a 10-year leap into the future. I was talking with somebody the other day, and she said, I've been going to telehealth conferences since the mid-90s. And, every conference, people were saying, hey, within 5 years, this is going to be happening. This is going to be a thing. I think with this giant leap that telehealth has taken, I really think there is no going back. And that's a good thing, because it's opening up a lot of opportunity. So for us as an organization, we're thinking, what are we going to do with our existing infrastructure, with our existing team, and with our existing networks? And we're really looking at pivoting towards a corporate health and wellness offering, and leveraging some of these new revenue streams that are available, and leveraging some of these new tools that we have. The problem, I guess, if we were to encapsulate it that way, is that really accessing preventative care is inconvenient. People don't really like it. I mean, it's time consuming for one. I mean, you have to take a day off from work so you can go to a brick and mortar clinic and sit around in a waiting room with a bunch of sick people just so you can get your birth control pills, filled. That, it just doesn't really make sense in terms of how we do so many other things. So most people engage with healthcare in a very sporadic fashion, and once you start to get specialists involved, healthcare for a lot of people is very fractured. You've got one specialist doing one thing, and then you've got another specialist undoing it and saying, no, do this. I see it in the hospital all the time where I'm admitting people because they are having a ill effect of a medication change that one doctor has made, and his other doctors are not even aware of. So all this really means is that there's low engagement. People that are quote unquote healthy or young don't really go to the doctor. And what this means is that there's a huge lack of data out there, and over the long run, this means there are more serious health problems and costs down the line. Another problem, as we see it, is that a lot of employee quote unquote wellness programs, they're a little bit more fluff than substance. There's a lack of actionable insights. There's no coordination with actual primary care providers or healthcare providers at all. These things feel good, but they don't really move the needle in any substantial way. So, what we envision doing, and we're not alone in wanting to do this, but is harvesting some of this data that is out there. We really are awash in data, but it's uncoordinated, and we aren't getting out of it really, I think, what we would hope to. What we want are insights, and we want to be able to help clients to come up with goals, and we want to develop metrics that allow us to measure their progress towards goals and get them into a cycle of iterative improvement where there is always a new goal on the horizon. Our vision for our company and what we will become next is to become the industry leader in delivering scientific wellness to employees. What is scientific wellness? This is Antarctica, by the way. Scientific wellness really just means leveraging technology and data to personalize healthcare. There is this large emerging market that has been termed the wellness as a service market. It is only getting bigger. And some of the sort of key tenets of scientific wellness are identifying risk factors before they cause disease, promoting optimal health, and optimizing longevity. These are kind of the three prongs of scientific wellness. It extends in many directions. This is everything from data from your Fitbit or your digital scale to continuous glucose monitoring to the human microbiome, things like that, and genetic analyses, identifying factors and then optimizing people's lives so that they don't suffer ill effects from risk factors that we are able to identify. This is my friend Chad Jukes. He lost his right leg to an IED in Iraq, and this is him stepping onto the summit of Mount Everest in 2016. This is looking down on a mountain called Makalu from the summit of Everest. So how are we going to do this? Well, we would like to do this. One, this is something that we already do, on-site and in-home lab collection. Telehealth is really, it's blowing up, but you still need to be able to make a physical connection with your patients. You still need to be able to gather biological samples, and this is something that can be taken to workplaces, can be taken to people's homes, and we think that that there's something there. Remote monitoring, this is, of course, this is everything from your weight to your activity to blood pressure. And some of these things really give you meaningful insights. Going to your doctor's office and having your blood pressure taken once, that's an almost insignificant data point. But send somebody home with a blood pressure cuff that measures blood pressure once an hour for a 24-hour period, that really gives you much more meaningful information, and it allows you to make recommendations that are really based on evidence and that aren't fluffy in any way. We really see, the goal setting, and in terms of, for a corporate client, we really think about creating a wellness community where certain things can be gamified, in terms of, what can we as a company do to change, can we all lose weight? Can we have better control of our blood pressure? Let's develop a 5K race, things like that. And, for the individual, this is designed to give personal insights for setting personal goals. There's also an aspect of this where de-identified data can give program managers insights into, how is the whole community doing? How are people feeling, for one? How are people doing on their goals? And so there's an element of engagement that we would like to create here. It's sort of conceptually, this program is tied together via an app, a website. It's a platform and it's a program. There's a lot of different directions it can go. I think laboratory analyses are something that we think is pretty important because that's very hard data. There are a lot of very high value interventions that you can take based on information that's gained in that way. But there is also a lot of things like asking people questions. I have a few things up there, some acronyms, PHQ-9, for instance, is the Patient Health Questionnaire 9. Very simple questionnaire, but actually very effective at identifying signs of depression. The GAD-7 is very good at identifying anxiety. These are things that, as I was speaking about earlier, really burden a lot of people, and there is a large burden of mental illness in this country right now, especially coming out of the pandemic. This is a kind of a simple mock-up of, one idea of how our app might look. We have some kind of beta versions put together, but we really see this as being the centerpiece to coordinate a whole ecosystem of other services, some of which may be third-party providers, some of which may be provided by us. Our target customers, similar to the kind of customers we service right now, a lot of self-insured companies, insurance companies, health systems, and really anybody that has an existing wellness program. It could potentially be a customer of this product. And this is our kind of roadmap. We've, as of now, March or April, we've have national infrastructure already in place. We're interacting with people and companies every day. We're collecting biological samples. We have great laboratory partners. We have some, a beta version of an app that I think within a month or two, we could have that working much better. And I think really by the midsummer, we could probably be rolling this out for early adopters in order to smooth out some of the details, get feedback from our clients, and aiming for a full program rollout in January of next year. We're currently looking for about $350,000 that will be spent mostly on development costs and just developing some of the program infrastructure, a little bit of staffing dollars in there as well to run some of our testing programs that we are rolling out with expanded types of data that we're collecting. And we think that this is a space that can be extremely profitable, and there is plenty of room for people in this marketplace. So that's all I got. Thanks so much for having me. Thanks so much for listening. If you have any questions or comments, I can tell you anything about COVID, or if you would like to talk about investing in our next iteration, please feel free to reach out.
Thanks so much, Dr. Olson. Yes, moving into Q&A, as I mentioned earlier, we do love your questions, so please send those on over. But David, we will just kind of jump into it here.
Sure.
So this is a question I think we've all wanted to know the answer to for some time now. When do you think things are going to be back to normal?
Yeah, great question. So, a lot of people are thinking that, June, that this is a month that I, keep having here thrown around, like, okay, by June, things will be more or less back to normal. And I think that to some extent they're true. I think it maybe depends on where you're living. The higher the percentage of people in your community are vaccinated, the more normal things are going to seem. In areas that have very low rates of vaccination, relaxing restrictions is just going to precipitate more outbreaks, more hospitalizations, and more deaths. And so, unfortunately, there's a sort of a geography of scientific literacy in this country, and I think in some areas, certainly June will feel pretty normal. I think in others, it might be a little bit more tenuous.
Okay, sounds good. Next question. This is actually a little bit personal for myself. I'm actually getting my first vaccination tomorrow.
Great.
So I'm nervous about it, to be
Don't
honest.
worry.
So A, are they safe? And is one safer than the other? Maybe. I mean, I'm sure we've all seen the news about Johnson & Johnson recently.
Yeah.
And can employers mandate their employees to be vaccinated?
So a couple questions there. So one, I would say that the Moderna and the Pfizer vaccines, I think we can now unequivocally say are extremely safe and extremely effective. As far as I know, have been no deaths associated with these, and there's been very, very low incidence of any side effects. And typically those side effects are something that looks like an allergic reaction, okay, and typically not life-threatening at all. The Johnson & Johnson vaccine, so here's the interesting thing is that on balance, it is very safe. I mean, there have been about 7 million Johnson & Johnson doses administered to people, and there have been about 6 cases of this rare clotting problem, and there's been 1 death that has been attributed to that. So, 1 in 7 million, I mean, obviously any death is bad, but 1 in 7 million is still a pretty low rate of harm. But out of an abundance of caution, we're pausing giving that out. And then others may have seen that the AstraZeneca vaccine in Europe is also having the brakes put on it a little bit for a similar issue. In terms of employers, employers absolutely can mandate that their employees get vaccinated. It is a work safety issue, and the Equal Employment Opportunity Commission has come out with extensive guidance on this, that employers can mandate testing and they can mandate vaccination. Whether you want to mandate vaccination for your employees is a completely different question, which sort of goes more into social policy and the sort of psychology of your workforce. No one wants to.
Is that a nationwide rule or
yes.
Okay.
Yeah, it is. The only exceptions to mandating vaccination is that if someone has what you refer to as a firmly held religious conviction that means that they cannot take the vaccine. Okay, well you can't make them get a vaccine because to do so would be discriminatory. But barring that, it is okay to mandate it. But I think everybody's situation is a little bit different, and they have to kind of navigate that on their own.
Right. And David, can you give us some maybe some feedback on how one might feel after getting vaccinated? Is it sort of like, I feel like maybe obviously everyone's different and it maybe is
Sure.
similar to the flu shot. Like some people feel it, some people don't. So do you have any
Yeah.
feedback on that?
So the first shot, most people feel nothing except for some soreness in your shoulder where you get the injection. It's the second one. So the first one primes your immune system, and then when you get the second dose, your immune system recognizes what's going on much quicker, and so a lot of people will at that point have a day or two of feeling kind of off. They might even have a low-grade fever, some body aches, but it typically not something that lasts more than a day or two.
Okay, great. Good to know for me.
Yeah,
Now
and
let's
it
talk
just
about,
means whatever you're feeling, it just means it's working.
okay, I like that answer. Good. I'm over here nervous. Now let's talk about schools, David. I'm sure there's some people on this line now, again, myself included, this at-home learning technique might not be working for everyone. So do you
Yeah.
feel that it's safe for us to be going back to school?
Oh man, such an excellent question. It kind of varies state to state. I mean, the people who are most at risk in that situation are the teachers, especially older teachers. And so, some states have really prioritized getting their teachers vaccinated because they recognize that this is,
Mhm.
kind of a pain point for them. In terms of children, I think that it is safe to bring them back into school. I think that until we have a better rate of vaccination, I think that things like masks are still very appropriate. Masks are the simplest, cheapest, but most effective intervention that we've had since the very, very beginning. Um, most transmission of COVID happens when people are speaking face to face, and
Right.
there's, tiny droplets that are transmitted
Especially
from
with
one person
kids,
to another.
spit's just coming out.
Yeah, and we all know kids are not, they're not affected by COVID to the extent that adults are. So for the most part, kids are, they're not getting sick, but they certainly do get the virus and they spread the virus. And so the question really is, who are the kids interacting with, besides other children?
Right.
So teachers, parents, grandparents, we need to make sure that you're not putting, vulnerable people into a position where they can be exposed.
Right. Fair enough. Okay, let's see. Next question. How has the pandemic affected the way employers think about employee health?
Yeah, it's interesting. I think that this has really made employers think about their employees' health in a much more direct way. People, I mean, a lot of our customers who are, opting to spend the money to test everybody, every week, these are people who, really care about their employees and want to maintain a in-office working environment or have to, keep an in-office working environment going. And we've had a really good track record of, I mean, we've had literally zero in-office transmission of COVID among the populations that we manage.
Great.
I think that this really, I think everybody, is kind of thinking more about healthcare and health and mental health right now, and I think that's going to continue. And I think that it may extend to employees feeling, that their company should be doing a little bit more
Yeah,
for them.
great. Now, can you tell us a little bit how the pandemic, let's see here, next question. What is healthcare able to do now to provide more comprehensive care after the pandemic?
Yeah, I think that I think this is about telehealth. I mean, now payment rules have changed. So there are a lot of things that are paid for now that weren't paid for in the past by insurance. You can have a virtual visit, and doctors actually get reimbursed. And I think what this does is it really lowers the bar for interacting with the healthcare system. It's not as much of an inconvenience. It's not as much of a time suck. And there are huge numbers of issues that just don't require an in-person visit.
Right.
I think if that can be coupled with the ability to gather biological samples from patients, then there really is a lot of information that can be gathered more easily, more quickly, and more efficiently than under the old paradigm.
Good. Now with telehealth, that kind of wants to bring me back a little bit to corporate America, right? All of us working these 9-to-5 busy jobs. Do you see this staying as a virtual situation for the near future? Do you think it will phase back into live in-person meetings, or where do you see that going?
My perception is that the telehealth option is something that people are just not going to want to go away. I think that, this is telehealth's moment. It's here. I don't think there's any way to go back. I think it would be extremely unpopular if, Medicare, for instance, said, okay, well, starting next month, we're no longer going to reimburse for telehealth visits. I mean, I think that would just be disastrously unpopular, and I don't think there's any turning back.
Sounds good. Okay, let's see, David, last question. What is the biggest unmet need in healthcare right now? What are we missing?
Well, I think what we're really missing, and about 95% of healthcare dollars are spent after an illness has started. This is mostly chronic conditions that are, being caught too late. What we're missing is that, healthy people, quote unquote, don't go to the doctor because of all these barriers. And so there's a lack of information. Every time somebody doesn't go to the doctor, that's a missed opportunity to collect information that could change the trajectory of their lives.
Right.
So I think that engagement and lowering the bar for engagement is important to getting more people participating in their own healthcare.
Sounds fair. It's good enough. David, that seems to be all the questions for now. Is there anything you'd like to add before we say our goodbyes?
I don't think so. Just everybody, stay safe, hang in there. There is another side of this, and hopefully we'll be there soon.
Great. Dr. Olson, thank you so very much for joining us today. To all of our attendees, my name is Lindsay with Family Office Networks. I will be following up with everyone individually, so if there's any questions or if you would like direct contact to Dr. Olson, I would love to make an introduction. And I hope you have a great day. Bye-bye.
Take care.